average HIPAA settlement in recent years has been over $1 million. And the companies getting fined aren't just large hospital systems. They include healthcare startups, software vendors, and small practices who assumed they were too small for anyone to notice. Here's how the penalty system actually works. HIPAA violations fall into two categories, civil and criminal. Civil penalties are the most common and are enforced by the Office for Civil Rights, the OCR, at the Department of Health and Human Services. Civil penalties are structured into 4 tiers based on culpability. Tier 1, you didn't know and couldn't have known. Fines range from $100 to $50,000 per violation. Tier 2, you knew or should have known but didn't act with willful neglect. $1,000 to $50,000. Tier 3, willful neglect corrected within 30 days. $10,000 to $50,000. Tier 4, willful neglect not corrected. A mandatory $50,000 per violation, up to $1.9 million per violation category per year. To put that in context, if you fail to encrypt ePHI and 500 patient records are exposed, each record can be treated as a separate violation. The math gets large fast. Real examples. In 2018, Anthem paid $16 million for a breach affecting 78 million records. In 2020, a medical provider paid $6.85 million for improper disclosure of patient data. In 2022, a dental practice paid $62,000 for disclosing a patient's ePHI on social media. Company size doesn't protect you. Criminal penalties are separate and can apply to individuals, including employees and executives, not just organizations. Knowingly obtaining ePHI in violation of HIPAA can result in up to 10 years of prison. The most common triggers for investigations: patient complaints, breach notification filed with the OCR, the OCR's own audit program. You don't need to have a breach to be investigated. HIPAA fines are real. They apply to companies of all sizes, and enforcement is active. The cost of getting compliant is always much lower than the cost of getting fined.